Hey, let's do it. On time. Thank you. All right. Call to order. This is the Desert Healthcare District Finance Legal Administration Real Estate Committee meeting, February 10th, 2026 at 1500. Make a call to order. Can I have an approval of the agenda?
So, thank you.
All in favor?
Aye.
Aye. On to meeting minutes. You can see the attached minutes from January here. I'd like to open it up. Any board comments first about those minutes? Anything?
No, I do not.
Any public comments?
No public comments.
Can I get a motion to approve them?
So, second.
All in favor?
Aye.
Aye. Public comments at this time. Comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The committee has a policy of limiting speakers to not more than 3 minutes. The committee cannot take action on items not listed on the agenda. Public input may be offered on an agenda item when it comes up for discussion and or action. Public comments?
No
Do
public
you have any
comment.
public?
I don't believe so. There's a note taker here, AI. Is that any of you guys?
Okay, somebody must have accepted it and just had it. All right, then, on to the CEO report.
Great, thank you. I have one item that's on the agenda and then a couple of items that are not listed. So we'll address the one that's on the agenda first. So in your packet is a draft budget for the Healthy Desert Healthy Use Summit that we're planning for in September. And the subject matter is related to social determinants of health. So we wanted to bring, just as an information item right now, the budget that we're planning on is right around $170,000 of expenses, and we do have anticipated for the revenue side of it, which would be include $100,000 from the healthcare district up at the very top. So we'll bring. The plan is to bring this budget and a request for the $100,000 sponsorship from the district, and also contract from our production people. Jeff Hawker, manager production, will bring those official documents in the month of March, but we just wanted to put this budget before the committee today, so you're getting an idea of what we're anticipating to spend, which is roughly the same amount that we had last year.
Great. How was the feedback from last year?
Actually good.
That's awesome.
Alejandro, you know.
Yeah, we had a really good turnout. It was much larger than the previous year. I think the change that we made in doing instead of doing a day and a half of sessions, we did 1 day of sessions, and then we did the tours, which were very, very well received. We visited a couple of locations here throughout the Coachella Valley that are actually doing work in their environmental health, environmental justice, air quality, water quality. So it was very well received. We'd had more vendors this year. That's part of the expo that we do. And we had some very high level individuals that actually were part of the panels, from state level folks to, county level, and then folks from Imperial County that are dealing with the whole lithium substance issues. They were able to join us and provide us, some information on what's happening down there, since we're not directly involved with some of those actions, but obviously we both share the Salton Sea, and the impacts on air quality and water quality are going to impact both counties. So we felt it was relevant to include folks from Imperial County as part of the conversation.
Nice. Any comments from the board on this? I know it's just informational, but
I have some questions.
Sure.
Okay, so first question, I know you did do the survey last year, and which was really good technology, and that was really efficient. Were there any comments about the facility, about things that they would have liked to have been done?
The only comment that we received plenty of comments. A lot of them were very appreciative of bringing the information to the region, and having local folks. I think what set us apart this year from last year was that we included community voices. So we had the promotoras, we had Conchita, Posad, and Dr. Cheney, and the group of promotoras that they work with. The only negative comment I think that I recall, and I need to kind of brush up on that, but that the restrooms were too far. They were not on opposite sides. There was only one on the very far end, but I think, the food, people liked it. Food was good. They liked the expo of the different organizations providing information, the coverage, the keynote speaker was also, we had really good comments on the keynote speakers and the panels themselves. I think folks really appreciated the information that was being disseminated through the different,
Very good. Next question is, the tours were something new. Are you planning on doing tours this next week?
not for this one. I don't think for this one, we won't do tours, but we're gonna limit it to just one day of, we'll have simultaneous breakout sessions. So since we are dealing with 4 different topics, we might do, we're still working on those issues, but, on those details. So we might do, I don't know if we do 4 breakout sessions or do 2 and then kind of, flip flop, the topics, the next hour. So we're gonna, we had our first planning committee meeting and we're scheduling our second one here at the end of February, early March. And then we can start talking about those details.
And I love the idea of having this conference. I think that definitely is necessary for us to have this annual event. And I know that you're going to continue doing the planning, that's fine. I was just asking about the tours because I know that was hard to, the logistics of it and so that was hard to do. So I was just curious about that.
Yeah, and that required a lot of like insurance planning.
Yeah.
Yeah.
The next one is Hawker. Is his price, is it the same or is there any change from last year?
I want to say, I didn't double check, but I want to say he was 40,000 last year. He's got 45,000 here. Don't check that. It seems like he was around 40 last year. Very good check.
I think he does an excellent job. He covers a lot of things and it takes a lot of off of staff. So that increase, you think it's reasonable?
I think so. I mean, and we're trying to, have him and his team do more and more.
Okay, good.
So that it doesn't require so much on us. I think we end up picking up some of, things, but I think we're trying to get him to do more with his staff.
Well, if he's gonna ask for more, make sure he takes on more off of your guys. Great.
Okay, so it is the same as last year.
Oh, okay.
This was 45 as well.
Okay, good.
Thanks, sir.
Okay, next is the cost per person. Last year, we charged or we did not charge?
Did not charge,
Okay,
no.
and this year, what's the plan?
We're just in preliminary thoughts with it, but I anticipate that we will not charge.
Okay.
I think it's better if we do it free to the public, but
So last year, one of the things that I was, I remember proposing that there be a minimal charge so that we would ensure that there would actually be people that would RSVP that would actually show up instead of having cover the cost of people no shows. So how did that work? Did we pretty much stay with the people that signed up? Did they actually show up?
Yes, because I think we had one day, I think last year since we had, or the previous year where we had one full day and a half day, we did see a slight drop on the second day. But I think this year having the new topics, I think that's gonna be something that more agencies and more individuals kind of gravitate towards. Environmental health, environmental justice is such a niche, topic, and there's only a handful of agencies that are actually, addressing some of those issues. But I think now having a broader spectrum of topics that we'll be discussing this year, I think we're gonna be able to draw more attendees to the conference.
yeah, one of the things that's a variable to that, with the number of participants is the food and beverage, and that's one of the larger components of the budget. So, so we really pay attention closely to that. And they are good about adjusting to more of what the actual is for attendance.
Do we use a local vendor for the food?
The actual location provides the food.
The Weston.
I was saying,
Has the
that
ability of that.
support as many local businesses as we can.
My last question is, what I was also, my recollection was that I was concerned about ensuring that we have good representation from throughout the, Coachella Valley in terms of stakeholders and ensuring that we have people from the west end, from, middle and east end. So, did we have that last year at the very end? I think we did.
We did, yeah.
Okay.
And even the panelists, I think, we try to draw from diverse groups,
Mhm.
from, grassroots agencies to high level,
Mhm.
state level agencies, regulatory agencies that are overseeing a lot of the air quality and water quality projects.
Okay, very good. Thank you.
A couple of questions. I think you said earlier about 300. You had about 300 attendees,
Actually, we had almost 400.
almost 400.
It might have been closer, yeah.
400. So, and this budget is built on 375 right
Okay.
now, so obviously that's.
What's the cost per attendee is how much?
The,
400 bucks? A little over?
um,
375 divided by
70,
175.
divided by 375.
I'll leave that to the CPAs, for that math.
Well, I have two of them.
How many got?
Everyone get it.
450 range. I think my mom's a math teacher. Okay. All right, that's good. Just curious. It's a good number to track to see if you add value,
And I think
Yeah.
part of the coverage that we get also from all the local news stations.
Well, they should definitely come in if KSQ is now we're primary sponsoring that. They should be out here broadcasting what we're doing
Yeah,
and make sure you have a,
think I'll have more.
whoever's going, I'll probably be there.
Right.
Make sure we have a concise message and hopefully we can present our strategic plan, maybe,
Mhm. Yeah, no, I think we'll get good exposure and
Letty can get up on stage
public
and
awareness.
share our strategic plan.
It's not a bad
En
idea.
español.
See? Por
Did you have
supuesto.
other questions?
Oh, yes. Okay. So do students attend?
They do.
High schoolers?
We've actually had, part of our sessions,
Mm-hmm.
around youth and that. So,
Okay.
so we don't have any specifics with our planning yet this year, but,
Okay.
Yeah, we did have a youth panel, as part of that, yeah.
We had a whole career path and how you get and environmental health. Great. Okay. And then lastly, so I did get excited too early about the tour. You immediately like that, but we're not doing that. However, and that's okay. However, I did want to, it's just a thought that came to me and it was something that we did a few years ago. We took, elected officials, stakeholders, everybody, and we went on tours of each of the shelters in the desert, so folks could see actually what was going on. And particularly because we're talking about social determinants of health, the rescue mission has a clinic there. Martha's has their clinic there. I'm not exactly sure, but we have the navigation center, and I don't know if there's a clinic there. But I think there's something to be said for that, just because I'm not saying we have to do a tour necessarily,
Mhm.
but to, so we can hear from folks, right? Because if you're, particularly if you're receiving healthcare services where you live, and in those cases, you're living in an emergency shelter, I think that that's a factor to be discussed in the larger conversation of social determinants of health. So I don't know what that looks like outside of a tour, but
Right.
we can,
Yeah, no, we're definitely gonna consider local agencies that are doing work around, some of the social determinants of health, and obviously, try to reach out to county level, state level, even federal level if we're able to do that. And we try to, look at different point of views from the actual people that receive the services or that are being impacted. That's why last year we included the community voices. And that was feedback from the previous year that it was too high level, that it really
Right.
did not include community voices, those that were impacted by environmental health or environmental justice. So that's why we modified the panel last year to include community voices as part of that, the youth, the careers, and environmental health. So then students could learn a little bit more about that. This year, we are planning to, maybe look at folks that are being impacted, those service providers, and kind of get a good mix of that. And one of the things that I know just popped into my head is the number of panelists, I think, might be shrunk down to 3 or 4. Last year, we did have 5 or 6, and it really didn't, folks didn't really get to speak, for a longer period of time, because we try to divide the time up until, between 5 or 6 individuals. So this year we might shrink the
Smart
number of
idea.
panelists to kind of give them more time.
Do we have anybody from IEHP coming?
We,
We should.
They were a sponsor.
But we should
Yeah.
consider having their CEO come
Yeah.
and speak about him as a safety. They really are a safety net here. And I think they run a really good MCO, and it would be interesting to hear from them. So if we want to make a connection there, I'm happy to send a couple emails, get him on the phone and talk about that. But, because they really are a safety net for us in this community here, and they run it appropriately, I think. And you're gonna highlight your mobile
Yeah, we could
clinics
do
there.
that.
They could be all out there, all the mobile clinics and everything.
yeah, we could definitely do that, and that's part of the
I think you
process
really
that.
highlight, it's a chance to show off the district too.
Mhm.
You're gonna provide content, but in that process, you should really highlight what we're doing. And if people come and they wanna know how to participate or be a part of what we're doing, man, it's a good opportunity to say, hey, we also have a foundation you can sponsor, you don't just have to sponsor the event. You wanna be a part of it, put your name on the side of one of our clinic vehicles, And, 750 grand. It's good.
Yeah, and as we get closer and we have more meetings with the planning committee, we'll bring some of these topics to the different committees and board to kind of inform y'all. And so, right now we have the big umbrella categories, but then we'll start doing some research of what's happening out of the community, what is impacting our community, and who's doing what under each of the different umbrellas. Then that's how we start pretty much identifying some of the panelists, the speakers, the keynote speaker as well. So then we're able to kind of make sure that everything flows well, and we
The
have.
IEHP guy would be an awesome keynote speaker.
Yeah.
To talk about how he's transformed that organization. Yeah, I
Yeah.
mean, I just think he would highlight everything we're trying to do. And they've been great to work with. We have some challenges at the hospital level, but to be honest, it's way better than what the VA does. They're way more effective than the VA administrator. Other thoughts too, I think, around highlighting what we want to, I know this isn't the whole point of this topic, but, really looking at, pediatric care and mental health and having maybe some speakers in that area to talk about like how many physicians are out here that are pediatricians? How many out here are actually delivering mental health care? Like, we've got plenty of cardiologists, that. We got, we have one of me or two of me and that's it, but we don't need more of me here. But we do need more of those people here. And it would be nice to like showcase some of that data. We talk about demographic data, we talk about in strategic planning, owning data and presenting data that doesn't exist. Like, that's really valuable because those are two areas that we want to help. And I'm happy to help pull those numbers and connect with the people that can pull those numbers, but if those align with our strategic plan, it would be perfect. So this is why we're doing what we're doing. Even you talking about how we run offices here. I mean, you guys run an office here and you give people the opportunity to come in and work here as physicians with you don't have to go work for the hospital. You can come rent from us and you get a great space. There's no other organizations doing things like that out here. So I just think we should highlight, RAP, you guys are doing it for us here. You rent out space to let people come in and be part of the community. That's huge to highlight what's going on. Yes.
That's what we.
Yeah,
we'll
there's
start-
all kinds of
There's just
things
so
that
many
we
good
can do.
things, like you just
But we also have to look
We
at,
should
where we.
promote what's being done at the staff level, district level too.
Mr.
What do you think?
Jim?
Yes.
I forgot one other thing I should have asked earlier. Last year, I believe I mentioned that I thought it would be something for consideration, would be a good idea to consider recognizing community leaders who have made an impact. Like, so just during the program,
That would be-
a youth member, people that are doing some work in the community. I think just that recognition would be something that you would consider adding as part of the program. It would also be, I think,
It's a really good idea.
Yeah, and these are all great ideas. We also have to keep, track of.
We can't do everything, yeah.
it doesn't need a lot. I know it takes a lot of time to put it together, but during the
Well,
program
maybe
itself,
the actual
but the program itself, I don't think it would be as long, but I know it does add work. So just for your consideration, I just thought I would mention it again as something that I would bring prestige to the event, to be, to be able to build over the years, prestigious acknowledgement.
That doesn't have to be much time. Your time can be with KSQ afterwards talking about the event. They don't have to make a 30-minute or word presentation.
Mm.
It can just be it doesn't have to be presented there. It can just be that we selected this and it's in a little 5-minute news blip about that.
Yeah, like a community champion award. kind of
Yeah.
thing.
Yeah, I think that would be good.
Yeah, maybe we could select one or two.
It's a good way to kind of get your name out there and get more people involved in what we're doing.
Maybe one of the IHP could sponsor that award.
It would.
$20,000 level or something.
At least.
I
I know. We just had a meeting.
They're giving us a 20% haircut on the,
Yeah,
that new deal.
I know.
No, that's a good idea, but yeah.
No, they are great.
They're good. I think they run it pretty, of all of them, MCOs and. Okay.
Any other questions on the? But, so again, we'll bring back more of the formalized, with the contract with, Jeff Hawker and request for the 100,000.
Are we doing RFP or we're just gonna use the same group for this?
I think we use the same group. They
Feel
know
like-
us, we know them. I think he does a good enough job that, at least we know what we're.
We're not seeing
What to
huge price
expect.
increases or anything. I mean, it's pretty.
The items just for information that are not on the agenda, I just wanted to communicate with the district, or I'm sorry, with the committee that we are looking at like some staffing deals right now. So a couple of the positions that are on our staffing from our budget, the one is the public policy analyst. We're going to start recruiting for that position. And then we are in need to fill the second admin and program assistant, which we've kind of held off on, and it's kind of intended for the program department as well as the accounting and finance department. So it'll be someone that will be able to help out in both areas and kind of an overlap with regard to the actual grants and the cost components of the grants, because as we're adding more grants, as we're adding larger grants,
Mhm.
There's a lot of administrative work related to that. So Erica, who does a great job with managing the grants and ensuring that we have all the cost analysis done, all the documentation, etc. It's becoming quite time consuming. So we figure a little crossover with also some support in the accounting department with that position, and that position is in the budget. So
Oh, the two positions are already in.
the two that I'm talking about right now are in the budget. So just wanted to inform you, we're looking to fill those positions. And then we are also working on some new job description. Won't give you any details on it yet because it's in the works, but a little bit more for planning ahead with our new strategic plan. We do anticipate, quite a bit of additional time and effort coming from our new strategic plan. So, and we'll bring those to you as they develop, but just information wise. And then also with regard to our chief administration officer, we did start the salary component out on the lower end to allow our great CAO to do some, development in that process. There's some additional goal things that we're working on to establish. But with that being completed, which we anticipate probably by April, would like to do an additional bump in the compensation because he is quite a bit lower in that range.
Yeah, we knew that last year.
Right.
Yeah. We thought
So
100%.
Would
So
that be before, sorry, to cut you off, would that be before because we're talking about later, this classification and compensation study? So would that be before that?
it would be
Okay.
before that's done, but
Yeah.
but the range that we have,
Wouldn't it be better if we wait until after the compensation thing?
however, I mean, the range that we have presently is 175 to 255, and he's presently at 166.
Oh,
Yeah, it's.
So I feel very confident in bumping up to that low end of
so
the
would that be
range.
part of his annual evaluation or is that separate from?
No, it would be separate because we've been working on, so we gave a, like 11% increase, with the annual performance review at the end of October, but like I indicated, we're continuing to work on some of the goals to increase to get, essentially kind of, breaking the umbilical cord a little bit from the training of accounting manager to more of like oversight there and moving into more of the additional, it's not changing job description.
CFO role now, though, to be
Yeah.
honest, I mean, he functions more as a CFO, I would say.
Yeah, so, so it's not changing the job description, it's just, you know, as Eric has been improving and advancing and that, I think it's appropriate to, getting him more in that salary range that we have.
I think it's your decision on the salary changes, but I just don't feel comfortable in doing it outside the annual evaluation period. So I think that would be more in line with that, unless something came out of the study that's gonna be done, saying we're out of alignment, this is what we're proposing, then I think it's justification to do it separately. But I think that, doing it out of schedule, it could also be problematic with other staff, that I just don't think it would be, when is your annual evaluation then? And I'm not even sure. if it's
In October.
October, okay.
And if we look at, you know, like with relation to all the other staff, they're in the mid to higher range of their salary, the approved salary range.
Mhm.
And as I communicated before, you know, when we promoted Eric, that it was promoted as, you know, below even what we had for our range. And that was intended to be more of a education, training type situation. And then if Eric proved himself, then my intention all along was to be able to bump him up as he's meeting, you know, the goals, but not necessarily on an annual basis. I would like to move that up sooner in the 2-year period and getting more in line with that lower end of the range, so that then when the annual performance review comes about and the merit increase at that point would put him in line with where the other management team.
Again, I totally agree that your reasoning makes sense, but I would be opposed to it. I'm not sure if this is even an action item. I just don't think it's appropriate to do it other than doing it at his annual evaluation, or if the consultant comes back saying, this is what I'm proposing for all of the positions, and looking at everybody across the board. And if that position is identified as being way below, then it comes for reevaluation. So I understand your reasoning, and no slight, Eric, I'm sorry, but I just think that it would be more appropriate to doing it at the regular review period, unless it was part of the job offer. If the job offer said we'll evaluate it in 90 days, then there's that expectation that you're going to do it. But if it's not identified as part of the hiring process, then I don't think that we should be doing it as a great job, Eric. No.
That's also part of my comment. The question would have been like, is it in writing? But I think it would have helped to say, hey, you know, after this point, you know, we're doing well, then we'll do.
Yeah, I mean, I should have done it in writing. I mean, where I talked with Eric about it and we were
We
comparing.
discussed it at the meeting, though, I think when you did
We
it,
did.
I remember a number of things. We looked at everybody's ranges, and the one that we called out, because I specifically remember looking at where you were, Eric, and I asked Chris specifically why it was outside the range, and it was in training. You know, we never said like we were gonna bring it up at a certain rate. I think it was just trying to see how he matured into the job. Maybe it's something we bring up to the board as a whole and just say, hey, this is a one-time step out of this because of kind of how we've I think we had some ascension in the role and needed Eric to step in, and I think he's done a great job stepping in, so. I would be open to, I don't know how long it's gonna take to get the study session back, you know, or the financial session back from those guys.
That's like a,
It could be a long process,
what is it, like a 6-month process?
yeah,
So-
like,
Depends on.
I
the
mean,
influence.
And just as, you know, to me,
we can take it offline too.
if I'm incorrect, please correct me, but my understanding is that the CEO is responsible for the staffing and the compensation. And as long as it's within what has been approved with budget and which the committee and the board has approved all of that, I'm bringing to you as communication, not as looking for an approval on it. I mean, if that's what you feel is necessary,
You wanna just bring it to the main board and just have a vote on that?
we can put
Maybe
it
that's
as a,
the best way to do it.
I honestly don't think that's necessary, but if
Oh,
the.
I don't know. That's the
If
way
the
to get out of
committee
this
would like it.
meeting.
I'm not-
Understanding is that when we approved the budget in June of last year or May, whatever it was, that you gave us a salary table of all the positions.
Mhm.
And that's the amount that we agreed to for all the positions. So if you are deviating from that, I think there, it does
I
require.
think
board
Eric
action.
fell outside the range. If I remember right, the one
We
thing that
weren't-
was flagged, I think he fell outside of the range for the position he was stepping
Yeah, it
into.
was.
He was below the range, and that's the only reason I remember is because I remember saying like, why is this outside of where we set it? And I believe the comment was, and again, we'd have to go back and look, was something about it being a transitional training thing. I don't think we ever put a stipulation. We probably should have said, hey, flag this for reevaluation in 6 months, which is outside of our normal employee evaluation. So I don't know if it's possible to get an evaluation from you on the performance, and maybe that gets brought to the board and say, hey, this is the request, this is why we're moving it up. I don't know. I think Eric's done a great job. I work with him probably more than anybody on the finances, so. I don't know if you're okay with it. I don't know how you want to handle this. I want to make sure we're open publicly about it
I
too,
just
but
remember it being that the range was submitted for us to be able to respond. And it was actually mentioned what each position was at, and that there was, that's when it was in, part of the approval was that the merit increase was up to a certain amount. So that's leads me to believe that we approved at that level. So
But
anything, if it was actually said that he was going to have a higher range, then I would say, yeah, it's your discretion that, but
Well,
It
but
was-
that's
Job
how the
title thing is what happened.
communication was that, you
we
know,
need to move on from this though, but yes, you can.
he was new in that position, and I believe you were even the one that said, well, his starting compensation is below even the approved range. So why is that? And that's when I communicated that it's a, you know, brand new in that position, not having served in that type of position before. And that, you know, I wanted to start him lower and then be able to advance him more so that it also didn't create conflict with some of our other management staff. Allow Eric to develop and then be able to get him bumped up through that range in, you know, a period of time. Now, in hindsight,
mhm,
had I known that this
Yeah.
would come up, I would have done all of that in writing, but it has been the CEO is responsible for the staffing, and as long as it's within the approved budgets and things like that, typically the CEO.
but
does
my
do that.
recollection is not as good as yours on this. But if you just gave your recollection, which actually makes me believe that we approved it based on that. And if, yes, hindsight would have been that you should have said in 90 days, I'm gonna reevaluate it. But to add another step in between, when he does the annual evaluation or the merit increase, I think that that's where you could bump them at whatever amount, and you're gonna include that in your budget that you have discretion over once we approve the budget. So, it's an information item, okay, but you've heard from
Yep.
the three of us, and
Okay,
we can move
And I
on.
think it would be helpful to clarify what you're saying, that it is within the purview of the CEO too. So now if we know that moving forward, then it kind of, okay, then we understand. But I think it's kind of, you know, that's your understanding.
I
I
would
take it.
don't have an
I would think-
understanding
I would think-
at this time, but
I would think most of our directors would know that by
I
now.
think I do,
Let's
but we
take
have a
it-
difference of
let's-
opinion.
We'll take it
right? So,
offline. Let's take it offline.
Exactly.
Just maybe present something a little more formally, so we can
Yeah.
say, here's
We
the
will.
ranges, and here, yeah.
You will.
This is where we started at the beginning, and this is where it was. 'Cause I was, anyways, okay. Eric, the topic of conversation, now you get to talk. Your
All right.
ears burning at all?
So, thank you. We will start on page 12, if we could, please. Just want to note, we're working on a few projects at the Medical Plaza.
Thank you.
We will be repairing another of the building roofs, after experiencing a few leaks. That's gonna be in line with the one that we've recently done. I think that's about 14,000 we're expecting on that. We're also replacing one of the ACs in Suite 1 East 201, which is an existing unit, it's over 23 years old. And again, the pricing on that in line with what we've been doing, but just keeping me up to speed on some of
We
the
don't require tenants to do these.
No.
That's amazing.
taking care of that. We're still 100% occupied.
Eric, on that one item, small projects, every year we probably do some small leaks. When is it time to do a bigger project? Is there anything, is there like a anticipated date that we're gonna have to do something more substantial?
There's several things that we're talking about. One, just been talking with Ann or Dr. Logston a bit, trying to build more of a plan in place to address some of those that have come up in the recent past where we are having to do small things to fix it, so we can be proactive and get that going. So that's in the works. Also just in developing next year's budget, we'll bump that up as well. We do have a couple of the bigger solicitations for things that we had talked about a couple months ago that hopefully we'll have out soon. It's just getting the scopes finalized with mainly with Rick and our project management to get those out. So one of those that's on the horizon that we did talk about was like the grading in relation to on the Toshiba side, because we've had different rainstorms that have led to flooding in a couple of the suites in that area. And so having that redone, new drains put in. So that's one example. And then with we're trying to explore options with sewer elements. We've got a couple suites where the cast iron piping is
Mhm.
reaching its age of use, and so we've been repairing them as they come up, but trying to find a plan to do that to avoid it before being proactive instead of reactive to it. So
Thank you.
that is on the
So it would be just a deferred maintenance list is what we're looking for.
Or capital improvement.
Yeah, capital improvement if you're gonna expand, or deferred maintenance that's been deferred for many years within the rehab. So
Good, thank you.
yeah, so we are looking at developing that. Still 100% occupied. Annual rent and CAMs estimated at $1,625,069 here. It's not on here as well, but I just want to note we are working on an updated agreement with IHP on the foundation side. I wanted to mention it here as opposed to the foundation board, just since I have my report on here. That's something we've been doing the last couple of years related to Connect IE. So once we can get that finalized, we plan on bringing that to whatever the nearest BOD meeting is for approval. And that way we can start invoicing for our work. The agreement value on this is providing up to $71,040 in income for the foundation. So it's in line with what we've had the last couple of years as well. That's all I have on my report here.
no actions, but always open for questions. Great, nice work again on the building. Financial reports,
All right, so financial
just the
stuff.
highlights, and then I think we'll just take action on all of them if you guys are okay with that.
Mhm.
Thank you.
Yep, if we could start on page 16. Second here. Sure. And when I'm referring just for notes, 16 of the entire packet, not of an individual report, just for ease. So, income right now is up approximately 974,000, mainly focused on investment performance and property tax income, as well as the LPMP income. It's kind of been the story the last several months here. Expenses are under budget, approximately 938,000, which is primarily that the savings have been primarily in direct expenses and professional fees. We could go to page 15 for a minute. This is just our variance analysis. So we've got LPMP revenue up, which is mainly due to being fully occupied. When I set up the budget, we did plan for a small, we didn't budget for 100%, just in case something happened throughout the year, so. By being 100%, that's kind of setting us up to be over budget as well as just the annual increases. Overall expenses on the medical plaza side are down about 30,000, which is a mix of over budget and under budget categories. The increased expenses related to plumbing we're talking about has been offset by some of the savings in other categories. Next note I had is on page 21.
So real quick on the professional fees, do we expect that to go forward at around $550,000 next year? Or was there something that lowered our PR and communications costs this year? Was there something specific that stood out that we were budgeting for that didn't happen?
One of the biggest things on the professional
Was it
fees,
just a,
the strategic planning was 700,000 budgeted, and we came in about 250 plus expenses, so.
okay, I thought that's what my recollection, we budgeted 750 because we had some quotes that were high, so, okay.
That was more like 350 or almost 400. Wasn't it?
I think it was a 250 quote plus whatever they had on top of it for.
I think, I mean, when we're said and done, it'll probably be 300 grand, probably with
The expenses are going up.
Travel.
Sorry, I'm
Lower than
thinking
I thought it
the
was.
contracts.
Yeah, they were actually one of the lowest
Yeah.
price one. The higher one we had was 750, that's why we budgeted 750.
Yeah, I remember that. I just want to make sure. That's what I remember the savings coming from. So. It's just-
That's a good question. What else, like, what does professional fees, what falls under that, just generally?
Sure. What we had budgeted was some legislative, for the work that we do with,
The lobbyists.
the Roberg Group, strategic planning. We had utilized, with NPO Centric, the capacity building agreement through them. HR consultant was built into that, and then some other miscellaneous are the main bulk. And so, when we are able to go over the budget, that's one of the items, one of the last few pages of the budget. We'll go over budget detail and give out the breakout
Yep.
of what we anticipate for that.
Okay, so, and like capacity building, I'm just asking because am I, like, does that include like, I don't know, any kind of training for anyone, like staff, or just because it's so far, like, there's such a variance on it, and I understand that that came from.
It
these
was a
strategic-
one-time variance, I think.
It's just, oh, it's a one time.
Yeah, I don't think it'll
Because of
happen
that.
next year because we kind of had an unknown amount, having never gone through strategic planning. So we had one vendor that came in really high and we hadn't finished a full analysis
Yeah.
yet. So we wanted to make sure that the board had
Okay.
full laterality to select who they wanted and not have to delay it another month to vote on it. So we said, hey, we'll increase to 750 on the budget to account for anybody we wanted to hire. And it turned out the one we hired was significantly less. So I don't think that'll go forward unless
Okay.
I'm wrong.
But in these, the MPO centric capacity building, that is a partnership we have with MPO centric, which is part of Regional Access Project Foundation, where we work with them to build up the capacity of nonprofits. So we have,
Oh, I see.
so they have a stable of consultants that go out. We determine which one of our grantees could actually use it, like a full agency assessment or a partnership, membership in MPO centric, which helps them get grant writing, other kinds of capacity building to lift up the organizations themselves. The contract does end at the end of this month, and we are meeting with Tally a couple days to go over an extension for that contract. It's been very, very successful. We've had some really good assessments that have been done of nonprofits. There actually have been some grants that we had said, you know what, you just don't have the capacity, but would you be willing to have full agency assessment? And a lot of them jump at it. They love it because they go from soup to nuts. They have to look at governance, finance, grant writing, fund development, staffing professionalism. So it's really beneficial to the organizations. But that's what that MPO centric partnership is.
Thank you.
You're welcome.
Sure. And then I just have one other thing to note, and then if there's any other questions, to try to keep it as brief. On page 21, which is our balance sheet. Just want to note, this was kind of something that came up at one of our recent, planning here with this just about 74.5 million in the investment accounts. 3 million of that was just the surplus from last year.
And the reason to highlight that is I think Director Rogers just took the difference from here and said that we had 6 million of interest on that account, which was incorrect. And that's the account.
There'll be a lot of interest.
So we have had good.
Wanna
good
keep it in the-
Like, where did she get $6 million?
Yeah.
Higher than
So
investment
it's just
person.
the, misreading of the balance sheet.
Yeah, when we have had increased performance on there because of the last few years as the interest rates changed and.
What was our interest? I mean, we know what we were earning, what, 1.5%, 2%?
I would have to look
It was,
specifically at that. It ranged because it depended on when the bonds were that we were getting, but Keith's done a lot, Keith's dribbling. has done a lot of
Last week
work.
on it, I think we averaged over the last 5 or 10 years, like 1.5%, 2%, depending on something. So yeah, it's not. That would have to be like 10% to make that money. So nobody's getting 10% interest.
Perfect.
Okay.
Those were my highlights.
I was confused by her email anyways. I wasn't sure where she was getting 6 million from. So I'm glad you figured it out. I didn't
I
know
didn't
you.
see an email from her.
Well, actually, she said
She
that
said it at the
at the
remarks.
board meeting. That's why she came up. And she did do
I have the email from her because I read it and I was like, I don't.
email as well. But also at the board meeting when she was proposing the 6 million. I think.
Oh, I wasn't part of that conversation, so that's fine.
Oh,
I didn't.
oh,
And she just commented, I think she sent us follow-up email about it.
right.
Okay. Anything to call out here on the rest?
Not specific.
Credit card looked pretty basic this month. Same with the discretionary funds. Any updates from you guys that you want to see any more detail on? We should go over the grant payment schedule just real quick. Just highlight anything that. we need to
Yeah,
call
on
out.
this one, I bumped up on here, the budget was reflecting the 3 million that was approved at the last board meeting, and then updated the budget to kind of get us up to speed, so we weren't showing that we were over budget, we were
Thank you.
right on par for this month, and then evenly distributed it across the remainder of the fiscal year.
All
right. So I'm gonna ask for a motion to approve the financials for this month. I'll second. All in favor? All right, so we have other matters. We've got a few actions we need to take. First one is for the compensation study that we've discussed. It's a $37,000 action item that we've reviewed multiple times.
Yeah, and the last time was to get some additional quotes.
Right.
Which we did, and so we received a quote from Gallagher Benefit Services and Moving Mountains HR Consulting. Both of these organizations do work with public agencies. Gallagher Benefit Services, their quote was like 49,000. Very extensive. I think they do a great job. They are 49,000. The other one, Moving Mountains HR.
Way too low.
I don't, that's way too low. Even though we provided the same scope of work, the coverage, I just don't think is, that one would be.
I mean, it wouldn't be very extensive. I mean, I know we got a good deal on sewing, but
It wouldn't.
I don't see how you can do a compensation study.
And
for
since
10
we're already working with RGS, they're familiar with us, they know our classifications or.
How do we get that connection? How do we connect with them?
Actually, we did an RFP for HR consulting services. There was.
So you're asking just to approve to go forward with that.
Yeah, yes.
Any questions on that topic about moving forward with RGS?
And so the addendum number 2 would increase their contract by the 37.
Correct.
7,000.
I'll move approval.
I'll second that. All in favor?
You have any public comment?
I have public comment. I didn't have anybody there but a note taker.
Yeah, there's no.
Thank you. No public comment. So all in favor?
Aye.
Aye. Thank you. All right, so we discussed briefly the Living Healthy campaign before the meeting, but I want to highlight kind of the history on that and then the opportunity in front of us here.
Sure, yeah, it starts on page 85. So what this is, consideration to approve the Living Healthy campaign with KSQ Kuna for 110,500. We currently are in a 12-month campaign, which expires on April 30th. So this proposed renewal would increase the value of the promotion, give us greater value of opportunities to share the work of the district, Includes monthly appearances on both Desert Chat and at Accesso Total talk shows. Total quantity and types of promotions are included in the packet. Value of the sponsorships, $211,520 for the commitment of $110,500. And to note, the funding for this campaign will utilize the existing budget, and then will be incorporated in the upcoming FY 26-27 budget.
We have any metrics on how we know that this is a successful way to spend our marketing budget? With our marketing director, I know he's not here today, but how do you evaluate? I would like to know how he evaluates a successful campaign versus one that's not. You know, what the objective is of this, you know, and it may be the same objective that he had on the original campaign.
Andrea, could you send him, meaning Will, the link right quick? If I can jump on.
Yeah, we can pause that, but I would just like to know for the board, just what kind of objective measurements they're gonna get to their 110,000, so we can look at the end next year and say, yes, we either met these objectives or not.
There we can wait for a little bit, or
You wanna move on to the next one, and then let's, it was, I don't know if we need a motion to just hold that item till the end. How do you do that?
we can just come back to it.
Are you okay if we just come
Yes.
back to that topic? Yes. And we'll move on to number 3,
Sure. This starts
information.
at page 100. This is informational, what we're looking to do and bring back, services contract, with DPMG. So we've talked a lot about, they've operated the district's mobile, unit and medical trailer over the last few years. As their current operating grants have ended September 30th and October 31st. The deployment of those clinics has been limited to events where DPMG helps cover the operational costs. So what we're looking to do while we wait for a potential grant application to come through, is to execute a services agreement that would cover the months of February through June. So that way we could get them back out of these events, you know, pair up with the Vision Clinic, pair up with Pink Journey, and we're working on the fine details of that particular one with them, estimating this would be about 250 to 300,000. But the intent here is to put it on your radar. We will have that, we plan to have that for this month's board meeting, but we would want to request that would be starting as of February 1st, just so we can get them going. We're validating, you know, the rates that they're proposing to what they've charged in the past, which they seem in line. And then we have a set amount for each type of clinic that we have. And then there'd be a variable amount to it. So different vaccines, that they would charge you to us, depending on the need for those who are uninsured, as well as covering some of the costs on the Pap smears for the women's wellness clinics. Which one?
So is it per clinic, like you charge like with
Per event.
parents per event?
Yeah.
Yes, very similar in methodology like we've done with Pink Journey and with
Organization.
Let's connect for the vision clinics, because the different types of clinics will have different staff, quantity of staff, and that way we're establishing the kind of set prices for each of those and what they'll be providing for that value, and then allowing them to bill any of those vaccines as they are needed. So. Unless you have any other questions or anything else you want to throw in there, Alejandro?
No, they've been very, great partners. They've been covering events, you know, since the last contracted paid event, which was at the end of October. So November, December, January, they've been out there on larger events. I try not to utilize them too much because it's all coming out of their pocket. But, you know, I think just for them participating out of their own cost these last 3 months, I think really, you know, shows their commitment to continuing to provide services to our community. And the great thing too, with the new addition of the pediatric clinic we discussed this morning, of how now we can leverage some of those services to work with all 3 school districts to provide on-site, you know, schoolhouse services, school wellness services So that's something that's kind of been on hold, and now with them having the pediatrics on board, they'll be able to expand services much more than we were doing with primary care.
So if I may. Okay, so I know this is informational, but it made me think of when Donna just asked the question about how we, looking at this and forming the Longstreet's question about evaluating, effectiveness of other programs. So are we putting this into our RBA methodology? Are we able to tell a story as to how we started and how we're doing over time?
The past two grants, yes, we have put into RBAs, we're measuring with the performance measures.
Okay,
But with the vendor contract, it's a little bit different, but I'm sure we can still incorporate
okay,
the numbers,
okay.
people being served and the services.
Yeah.
Well, and I think we were, speaking of, doing this as a vendor contract right now,
Mhm.
due to the sensitivity of time to be able to get them into a contract to finish out the fiscal year, will allow them to develop their next grant. Because it is taking some time to get all the parameters done with the grant application. I think that was the intention, wasn't it? Give in the vendor contract for now, or were you looking at it as a long-term?
Looking at more long-term, labor contract.
So more as a partnership
Yeah.
than going through the grant process.
So you'll incorporate it in the RBA methodology?
Yeah.
Okay.
The vendor, yeah.
Yeah, sounds like there's a
Thank you.
partnership track that
Because
we need
it's
to
out,
look at.
it's outside of.
We should probably look at a partnership track down the road.
Because
for-
we've done it with others, excuse me.
Yeah, you're fine. Go
I
ahead.
mean,
Add on
just the
to it.
whole thing with Pink Journey, the numbers that we've tracked and what Megan had put together for the whole infographics, and we think, those are more telling than, just.
So are we including in the vendor contract, like all the reporting and
We need
things like
to.
that,
Yeah.
that would be in, that's what
They
I'm
have
dealing
deliverables,
with.
just like all the
Yeah.
other
We
ones
do
there.
need to include it, and that goes back to the strategic plan and collecting data and how we want to, especially as you go from the grant process, which is very rigid, to a
Mhm.
partnership track. It's a different process, but I think it's an amazing story to say, hey, you were a grantee for a while, and because of what's grown in the relationship, now we want to partner with you. I mean, I think that's a testament to the quality of
And that's
work.
fine if we're requiring the same kinds of things.
That would just go into the contract. I don't know if Jeff drafts these contracts. I don't know who drafts these contracts.
We utilize the format that he has and then it's
Template.
running by.
Yeah, we get a template and then we plug in, I work with Eric, I'm
Okay.
plugging in and guidance from Donna on
We
on
always
the
say
reporting and
Jeff.
everything else. Yes.
The reporting that we built into like the Leston Act and the women's wellness has to do with the quantity of patients seen or vaccines delivered. It's not quite to the same extent that we have in the grant level, but
We
We are
can
getting
incorporate
those.
some things. I think they should.
Yeah.
We could still ask those questions, especially the last one, who's better off?
Yeah,
That's the best question that.
Yeah,
I
it's a
was
very
like,
litmus
no,
test, litmus test for sure.
Yeah.
So, yeah,
Who's Better off.
yeah,
One
that
of the
was,
things that we gotta make sure when if we're doing more of the vendor contract part is, we're not requiring like we do with grants, like our financial statements and things like that.
Oh, we should.
We need to incorporate that stuff, otherwise, I mean, especially, the size of the. And that was my understanding, why part of the reason we were doing the vendor contract right now was to help them get into the grant process, because they are due for an audit, and they haven't had, so we wanted to continue these services, but we don't want to relax on the requirements that we have.
I don't think we should ever relax on the auditing process. I think we
So
should.
right now, they're not able to do their audit?
They just haven't done
Oh, then they
So-
need to do
it. They need to
it.
do it.
I thought it was because they had just started their nonprofit. or
No, no,
something.
Well, that we did with them when we started with
Last year.
them 3 years ago.
So now they just haven't done it, then they
Now
need to do it.
that should be on their own, and they just haven't done.
yeah.
Right.
And that's part of some of the things that we could incorporate. It'll be almost like we had discussed like a hybrid model of ensuring that we do have some of those components of, the reporting, the fiscal component, the audit, to ensure that that's a little seamless, and that we're still able to hold them accountable with the reporting. But what I like about the services contract, it's on a reimbursement basis, it's not upfront. Just like a typical grant would be, so this is almost, there is, just looking at the grant values from previous years to this,
Service, yeah.
this is a little bit, there'll be greater cost savings for us as a district on some of these items, because, we could deploy them, 3-4 times a week, which we have been, doing, so it's.
This is something we should take back to the staff, and I'll be great for Chris to say, hey, maybe we need to build a partnership vendor policy. I mean, I don't like a lot of policies, but I know we have a really good grant policy, and I think with strategic plan, we are gonna have, one of the big sections was partnerships, and
Well, I think we definitely need, to shape some policy around.
I didn't really think it was gonna go that
what's
far,
going
but
on. Yeah, but, and I apologize if there was misunderstanding on my part, Donna, that,
it was a
we
little
just want to
fluid
make
at one
sure that
point.
we're not missing, these things that make our grant process so tight.
Well,
So,
I agree.
But I do want to note on this one that based on the feedback we have, that audit would not be in place prior to being able to
Okay.
award this contract.
correct.
But it would be in place before it actually comes as a grant, which
It
would be.
would have to,
5 months.
well, or if we come back with a new vendor agreement, we've got to establish then the policy that ensures that we have all those.
We need a partnership policy that
So we would,
looks just like the grant process.
with the grant process as well.
Well, that's definitely ideal to have that policy, but if we don't get that policy in place, the practices that we do require audits. So.
Yeah,
it would
before
fall-
we go forward,
Okay,
I believe we're on that page that
Yeah.
They need to give us their audit.
before we go forward beyond this, they need to have.
Oh, definitely.
Yeah.
Yeah, I mean, this was kind of a,
This
Like
is a
you-
fill in the gap,
the fill in the gap, we're very busy, we need the service.
right?
This is still met, but under the understanding that you will provide a full audit.
Yeah, and this will give them the time to.
They just need to know they need to
Correct.
stay on, they should have a deadline, and they shouldn't be late on the audit, because you control the purse strings.
We've been bending just a little bit along the way with
We really-
it, so.
We really can't, I mean, I get it, but we really can't bend much longer. I think this is the last bend. Okay. Thank you for that. I think Will's on.
So the plan would be to bring an actual completed vendor contract to the board meeting.
I'd like to see, yeah, we can do that, and then before we issue more larger ones, we
Right.
should really sit down with probably legal, you guys and you, and come up with the start of that policy. It doesn't need to be complex, it just needs to be, these are what's required for this, and this is what
Make sure
exactly
that
we
we're
need.
covered like we would.
And then each contract in it can have specific metrics depending on what services they're providing.
Sounds good.
To safeguard. Yes. Back to number 2.
Okay, so Will, thank you for being here. There were a couple of questions that were coming up that I didn't know the answer to, so.
I'll just
Appreciate you joining us.
I'll just
and-
rephrase the question. So
Yes,
we were looking at the increase in the KESQ contract, Will. It's probably double what we did last year, but we understand it's a pretty good opportunity from how it was presented here. And I think a couple of the questions that I had, and I don't know, Letty and Denise have questions as well, but really around obviously what kind of value is this creating for the healthcare district in addition to the value that was created from the prior contract? So why should we do this? What kind of metrics are we going to use to track, say, hey, this is a successful investment for us from a marketing standpoint?
That's a really great question. So basically, we're doubling the investment, but we're also getting double the exposure. Just in the number of times the interviews, the vignettes are going to be shown, the number of digital impressions online for our banner ads and that sort of thing. And KSQ, they do a lot of the metrics. They provide the metrics for us. What I particularly like about this deal, it is a lot of money, but I like this campaign in that it is a media company and they are going to be very much promoting their own event. And whenever they do that, it's going to say presented by the Desert Healthcare District and Foundation. Even when they're showing vignettes and interviews by other sponsors, it's presented by the Desert Healthcare District and Foundation. So there's going to be a lot of exposure. And anecdotally, I think some of the directors who participated, and thank you all for doing that. I mean, you're hearing in the community that people are actually seeing these vignettes and interviews, but we'll definitely need to get the metrics and we'll get those from KESQ.
Were you interviewed?
Yeah, a few different times, and we've done some vignettes and interviews and that, so.
I
I call
think
them
my
vignettes.
autograph a couple of times.
Wow.
Mhm.
You never signed anything for me.
And I would keep in mind that they actually have 5 TV stations, 1 radio station, but 5 stations. So they have a pretty broad audience.
I think I would just like to see metrics coming back, maybe at the board meetings, just to see, because I don't think we've seen much. I know you have it, but a lot of that media feedback, to see how this contract works, what kind of exposure, what's the click-through rate on the banner ads, and there's 1,000 things they look at when they present it to you. And I know they have the data in the background, time on site, links back to our page, things like that. Because it'd be nice to track who's clicking through, where they are in our community, so where they're connecting. Are they in the East Valley, West Valley? And I think they have a lot of that data based on the IP addresses. So it would be nice to know where that is and to kind of overlay, where we're actually getting more traffic, and then maybe we can target those areas a little more.
Absolutely. I'll make sure I get those for the board meeting.
Awesome. So I have some metrics on that.
Thank you, Will.
Thanks, Will.
Thanks,
You're
Will.
welcome.
Is there any, I should ask, did you have any questions for Will? Let's take action on that. Can I get a motion to approve that number 2?
So moved, second.
Okay, all in favor? Oh, sorry, public comments.
No public comment.
Take your decision. All right, all in favor?
Aye.
Great, thank you. We have an update on the retirement protection plan closeout. I think they put
Thank
together.
you, Will.
Oh,
You're welcome to stay on if you like, but I think, we accomplished what your services needed.
All right. Thank you.
thank you. And then I think Eric has some updates on trying to close out this retirement plan for prior employees at the hospital when we were running the hospital. And so we were looking at options. I'm just gonna give you the background on how we can move that off of our kind of financial obligation and move them over into another servicing agent. So we don't have to worry about waiting for these people to retire or when they want to pull their money out. We can just say, all right, we're done, because we're not in the business of running a hospital or a retirement plan for non-employed people. So,
Sounds good. Yeah, the recommendation on this particular one is to seek approval that the CEO and staff take the appropriate action to close out the Desert Hospital Retirement Protection Plan. So that would involve a couple steps here. So we've been working with our actuarial NIHART to discuss how to do that. Given a little background as far as what the plan exists, but part of the challenge with this is each year as that plan exists, we have to have not only our actuarial report done, but also an audit. There is staff time involved in just not a ton of staff time, but we still have to process all the requests that come in, as well as send out all the statements at the end of the year. And so what we're looking to do is get approval to move forward. Right now, we do have an estimate from NIHART that the closing out of the plan would be about 65,000. Some of those can be paid directly out of the plan assets, and we would budget the remainder in this upcoming budget. We also need to execute an agreement with a legal firm. So we have worked with, where are my notes here? Davis Wright Tremaine. We've worked with them on the retirement side of things before. So we would want to work with them to take the right steps that we need to do. And we don't have that contract in place just yet, but that's where the approval comes in. And so we can get those in place and then bring that back as an informational item. That we have to amend the plan to allow this to occur. Then NIHART would coordinate trying to send out the option that all participants could then take a cash out. Because right now, one of the elements is in order for them to request a cash out or a rollover, they need to no longer be employed with tenants. So amending the plan would allow current employees to do that. We'd have a campaign to send out notices to all participants, encouraging them to cash out. For those we can't reach, for those who choose not to cash out, it would then be coordinated with a third party to transfer over the liability and basically take on the any annuity payments, and that way we could get it all off of our books. At this point, on our books, we have the $2 million pension asset, so by getting this all transferred, that would net us money at the end of this that we could then utilize as opposed to just having it on the books, as well as the annual savings, which is averaging about 15,000 per year, just with the audits and whatnot. Audits and actuarial reports. So right now, some of these could be paid for plan assets, but basically we'd be budgeting this in our upcoming budget process and would look to have approval to move forward to do what we need to do in order to do that with Nyhart and the legal counsel.
So essentially what it'd be is that we would bring to the board meeting the actual contract engagements with both Nyhart and correct me if I'm wrong, Eric, but Nyhart as well as the Laughlin that Stewart was with. And Stewart will just help ensure that we've got all the legal stuff done properly with it. Jeff Scott, our district counsel, is highly supportive of using Stewart because we've used them in the past, and Jeff's very, he knows them well, so.
I have a question. Mr. Chair?
Go ahead.
Okay, so, do you think you'll have the legal, agreement by the board meeting? Okay, I move approval. Okay.
Anybody on the note taking has any comments?
No.
Okay. All in favor?
Aye.
Aye, beautiful.
Okay, the last item on.
Nice work, by the way, nice work getting that solved. I know we've been talking about it for 3 months and you guys executed very quickly. I thought it would take over a year. So,
Well, it's gonna take the process
I know,
will
but
take.
just
a while.
getting it a process in
Yeah.
place, I didn't think we'd have it done have something in place until next year, so kudos to working on that quickly.
Thank you.
And the 2.1 leftover is just gonna roll into our,
We'll get that money's back, whatever the remaining amount is. They'll probably fluctuate some because some of it's gonna have to be
Yeah.
annuities that will be defined, and so that might reduce that balance because it's a larger amount going to the employee.
informational update on the handbook.
Yes, so third on page 115, just an informational item here. So as we've noted with our contract with Regional Government Services, who provided human resource services for us, they had completed an assessment of the district's HR program and provided recommendations. One of those recommendations was to conduct a full review of the district handbook. So we have been able to complete that review. And update was issued for the January 2026. So we've been able to provide that to staff, which is another element of their recommendations. And so in here, we've attached this for information. If you have any questions, we'd be happy to answer.
Go ahead. Oh, no, I was just gonna ask, was this already previously brought to this committee? The handbook, like it's been.
Back in 2020, but the
Oh.
updated version,
Mhm.
that's what this is the updated version that's being brought as information. And so we've worked with RGS to update it to make sure that we've got all the legal HR requirements in it. We've also then run by Jeff Scott,
Mhm.
legal counsel as well. So essentially it's our employee handbook that we've had, but just with all the necessary updates.
Okay, there were just a couple of things, I mean, kind of, it's done a little bit now, but that I did want to flag, and it was something that came up earlier today in a totally different setting, but on the whistleblower, so the whistleblower protection, oh, there it is. Okay, and then there's the complaint process, so they're kind of close together. But I did want to point out on that it does say who to report to. I'm trying to find it. It does say who to report to, but I think I saw that it doesn't say how. But I think there's something about it could be verbal or whatever, but there's not like an email address, or it doesn't say like, oh, you could mail it. Like there's not an actual, like, if I want to, make a complaint, or I want to do something, it just says who it's supposed to go to, but it doesn't say how. So I think that might be at least something to take a look at, I don't know entirely if it's required. And then just one other note, I think it does say, still can't find it, so I'm going off the top of my head. But here it is. Okay, if the employee believes that they've been the subject of harassment, discrimination, retaliation, or other prohibited conduct. So I guess that's supposed to be kind of a catch-all, but it does kind of narrow it to like these things and prohibited conduct, but I know it could be like financial related, like it could be outside of that, like if you have something, you know, like an accounting irregularity or whatever that you feel like you need to flag. And so I understand that could fall under prohibited conduct, but at least to me, reading it, it's not clear, like, okay, if that's an issue, if it's something of a financial nature, does that fall under here? Because based off my reading of it, it's just, you know, it's more harassment, discrimination.
You have a page number you can refer to.
Yes, page 10 is where I'm at right
Oh, the
now.
whole book, okay, just a second.
Yeah, in the book, title part is complaint process.
Page 2. Harassment
Sort of
prevention
bottom
training.
there, yeah, and scroll down just a little bit toward the end. Keep going. Oh, next page. Sorry, 10 of the, yeah, right down there. So there's, yeah, the complaint process. So just two things that, as I was looking at it, kind of stood out to me. So the how to go about submitting a complaint, and then also what the nature of what kind of complaints that can be made. The subject, I guess.
Mr. Chair, I also have some questions. If I may.
You may ask away.
So I'm surprised that it's informational. I would think that it would be an action item because it is policies that you are instituting. So I think that that is something that actually requires board action. Second thing is, I'm surprised that we've only done this every 4 years because it's my understanding from other boards that I'm involved in, and involved in several boards, this item actually comes to us once a year because there are new employment laws every year. You know, for example, the rules that just were adopted in January, I'm still waiting to get those updated to introduce them because usually I get it in January, and then so I'm able to actually act on that. But so I'm surprised that it's every 4 years. So that's kind of a comment.
Well, I can wait till you're done. I would
Okay,
like-
it maybe it's because it's a special district instead of, but it's still employment laws, so I'm just kind of a little bit surprised about that.
Want me to respond to
Yeah,
that
yes,
now?
please.
I'll wait.
No, go ahead.
So, you know, we had checked with our HR consultant, who's no longer with us, but that HR consultant, I forgot her name. But when we did the update in 2020, you know, checked with her as far as any updates that were necessary, you know, like 1, 2, and was said that it was fine. So
Yeah,
part of the reason we don't have that consultant, and that consultant, I won't even go there because that gets me in trouble.
Maggie, Miss Maggie.
There was the former CEO that got that consultant here with us. That's why that consultant is no longer with us. So then we've been working with RGS to do it. So,
so you anticipate doing this every year then? To make sure,
we will be looking at,
okay,
and I think now that we're working extensively with RGS, then we will be looking at, you know, whatever new laws, HR laws
okay, good,
will be reviewed and updated.
okay, good.
And we can bring it back for approval. It just hasn't been done that way. It's been because the legal counsels and HR consultants. But we can certainly bring it for approval.
I would feel a lot more comfortable, I think, to protect you, that all of these policies have been approved by the board rather than just, there are policies. So, I think that those are the main things, is that when you do it once a year, every year, then you're able to identify what are the changes, and that's the other thing, is that what's changing from the last handbook to this, or what is changing, so we could actually, you're overwhelming us with information, but if it's every year, then you'll be able to tell us what is changing, so that way we could actually be able to, but.
Would you like to give direction then that we can look at these edits that Director Smith has talked about? And then bring it to as in action and then to the February board meeting?
Yes.
Well, knowing that you're actually starting from fresh, I'm gonna actually go back and actually take a more, take a better look at it.
When you say
Because-
starting from, right?
Because you're saying that this new consultant now is creating a new book, really.
No, I just said that it's our handbook that's been updated by,
So this is the.
it's our existing handbook, it's not a brand new
Okay.
handbook.
So, but the last time it was updated was 4 years ago. Okay, I thought they actually started from fresh,
No,
using the.
we
okay.
used ours, we just went through it and updated it based on any new laws.
Okay.
We, refreshed it as far as did some formatting changes, things like that.
We do that
That's
in-house.
not brand new.
We do all those updates in-house.
We do them in-house, but in working with.
The RHR.
Yes. So, and then also having, our legal counsel look at it as well, so we're seeing from both sides. from the legal perspective, so, but we're happy to bring it back as,
I'm okay with moving it forward, but between now and then, if I have any things that I'll put out that I find that are a little bit, not clear to me, I'll send you an email.
okay.
That way you have a heads up. And if it's something that you can address, and if you feel like maybe it doesn't need to be addressed, just tell me what it is. And then if you think that there is something, you can decide whether it's something that needs to be incorporated.
And if we ultimately need to bring it back in
Yeah.
March, it's. not-
Well, now we have an attorney that as a board member, so she will. So it's really good to be able to.
Free of charge.
Yeah. But yeah, I do want to take another look at it. I didn't look at it as carefully as I.
So would you rather us just bring it back in March?
If that's. okay.
Wherever you want to bring
Yeah,
it back
that
to
way
the
there'll be
finance
less-
committee.
Or get the consent from
Yeah.
the committee, but
You want it at the finance committee or the policy committee? Where do you want to have this in? You can have it here. We do money things, but I don't mind reviewing it.
well,
It is
well,
legal also. We're
we're legal.
admin legal and cover a lot of.
I guess we are legal.
I think we are.
We never have our legal team here, so I'm always like.
So,
Yeah, all right.
so
good.
that's why we bring it here, is it's more, it's not
Forgot.
finance, it's more administrative.
Sure, let's bring it back here and
Okay.
then so a little direction on just sending your updates into them. They're gonna, okay, we'll bring it back.
So we'll bring it back at the March.
And is this something that ever
Great,
gets
thank
approved
you.
by the board that we need to send to the board, or is it all informational to the board? It's
It
been
would be-
updated as for comments. How would you like to do that?
Say that
Does the
again.
board approve the handbook, or is it just saying, hey, this is?
Well, what we'll do is we'll bring it for F&A approval, and then based on your recommendation, it would go to the board and we put it on the
And
consent.
Jeff will say he approves this, because I mean, it's 178 pages, or whatever, so legal counsel should read.
Yeah, so, and we'll make sure, and he has.
So as long as he gives us his like, hey,
Well,
well, approved by,
If we note that in the staff report, is that,
that's all I want to know, is that
Official?
Jeff's reviewed it for me.
yeah, because RGS and then.
Well, and mostly just to protect the board members that we're not approving a handbook and that need to be approved by a legal counsel.
Right, yeah,
All right, good.
so,
Thank
okay,
you.
we can do that. And also I wanted to extend apology for my pushiness, or however I did earlier when we were talking about Eric and the CAO.
Oh, no.
So,
We can take it all offline, that's
It-
fine.
me too.
And I didn't want to pick on Eric, so I wanted for that too.
All right, we'll adjourn today.
Well, before we adjourn, I do want to mention in committee member comments, you talked about IHP earlier. I do want to mention that IHP Foundation is having a summit at the Annenberg Center on March 26th at 1 p.m. And they're going to be convening many partners. I hope that that's on your calendars and that they actually, the CEO reached out to me and asked me if I would serve on a panel representing the district. So I think I better make sure that you guys are involved in it if I'm there representing the district, so FYI. Okay,
Do you have any information on it?
I don't think they just asked me, so, a week or so ago, so maybe they're in the process, but I'll make sure that I'll let them know that they need to send you an invite. Okay, and the rest of the board.
Great.
What date is that again?
March 26th at 1 PM at the Annenberg Health Center.
Yeah, it's Navigating Medical 2026 Policy, Practice, and Partnership. Collaboration with IHP Eisenhower and RAP Foundation, IHP Foundation, IU Vibrant Health, Forum Navigating Medical 2026. Attendees will learn about Medi-Cal changes, how to use benefits count, CBL accounts.
So they say,
Yeah,
I know, they told me,
house do I need to know?
no, they told me Desert Healthcare District, RAP has nothing to do with this. I'm surprised. You know, it's kind of still in the process, I think. Yeah, because it
on the
really
website.
is. They asked me.
Favorite phone call is.
Okay.
Okay, any other comments on this?
No,
You still have
thank you.
another opportunity to comment on it.
Okay.
We're gonna adjourn, move right into the foundation meeting. Can I get a call to order